I'm Heather Cross. I'm a registered nurse from Niagara Falls in Ontario, and I'm a union leader for 1,400 hospital sector nurses in the Niagara region there. Local coordinator for Local 26.
Great. How do you feel about being here at the Canadian Labour Congress Convention?
Nurses as a whole are not very political animals. Nurses are mostly interested in being able to provide proper patient care. We know how valuable it is to our clients and to their families, and how important it is. And nurses just assume that the government is going to sustain that and recognize how important public health care is. And so for me, as a union leader, I've come to recognize how important the lobbying for the CLC is to make sure that our health care is sustained. And for me also, it goes a little deeper than that, because coming to the CLC, when I look at the things that the CLC is putting forward as resolutions, things like managing poverty and improving the economic status of Canadians, and things like making education affordable, making seniors' lives more so that they can access medication, and these are the kinds of things that we call social determinants of health. The more, the better the social status of a human being is, the better their state of health is going to be. So these things that the Canadian Labour Congress is fighting for in our country are things that really improve the lives and the health of Canadians.
And I guess as a nurse, you see these social determinants of health directly connected to your patients' well-being.
I live in Niagara Falls, as I said, and behind all the beauty and tourist glitz is a community that's really struggling in terms of our social determinants of health. Niagara area has a greater percentage of seniors than most areas in the province of Ontario. Our level of education, average education for the people who live in our community, is a little bit lower than provincial average. We also have very high rates of unemployment, and so these things, we've lost a lot of jobs. A lot of our industrial sector has been closed down and offshored, and so these are the things that really affect the health of our people. I've worked 36 years in the Niagara Falls Hospital, and I can tell you I have seen some of the saddest, most terrible things in terms of people's lives in the course of my work, but there hasn't been a day that I would trade what I do for anything else, because it's really important, the opportunities that we have as nurses to really impact people's lives. And understanding the impact of poverty and education on health of people. Really, if I never see another senior come in because they can't afford the medication, or they can't afford to have somebody provide care for them, or they can't afford to provide food, if I never see another child come in with a fever from an abscess because their parents can't afford dental care because the dad is unemployed and have no benefits, if I never see another hungry child, if I never see another man try to take his own life because he has lost his job and he's lost all hope and can't imagine how he's going to provide for his family, if I never see those things again as a nurse, it will be too soon. So it's very important that as a Labour Congress, we push forward for providing for all Canadians so that we can all have equal access to health. And I will also say one more thing in regard to education. One of the saddest things in our country is the shame of our Aboriginal communities. And from the perspective of a nurse, to know that a little girl in an Aboriginal community in Canada who wants to be a nurse cannot succeed in that, because when she graduates from grade 12, her education level is not the same as my children's graduation level. in a white middle class community. Her high school diploma often will not provide enough for her to succeed in university, so it's impossible for her, even if she wanted to be a nurse, to learn what she needs to know and then to go back and service her community. So that tragedy from a nursing perspective in the Aboriginal communities is also something that I see that the CLC is taking forward very much, advocating for those who are underprivileged in our Aboriginal populations as well.
I did also want to ask you about how the hospital cuts that are coming down in Ontario are playing out on the shop floor for you, with your colleagues, other nurses, other healthcare workers. What are you seeing around you?
Well, as I said in the very beginning, nurses aren't very political by nature. However, when they see their ability to practice dwindling before their eyes with cuts to staff, with the increasing of workload, the impossibility of keeping up with the things you know you have to do for your patients, going home at night and not being confident that you've been able to see to everything you need to see to for that poor patient that's in the hospital, those are the things that create political action in nurses, because truly the overtime being worked, the fact that we are sicker and more injured than most other sectors of workers in the country because of our working conditions, and the fact that just so many things about what we want to be able to do with our patients we can't do anymore. Those are the things that cause nurses to kind of speak out and advocate for their patients. And it's good to know that as a representative of the nurses in Niagara, that I can come here and make sure that our voices are also being heard on behalf of our patients, so that when we go to work, it's a safe place for us, that we're not going to get hurt or injured because of our workload. We want the system to care for us so that we can care for our patients. That's the most important thing.
Very good. Thank you and congratulations on your work. Good luck with it.
Thank you.